Christina. I'm a nurse practitioner student. I'm going to be conducting your head, ears, eyes, nose, and throat exam. Is that okay?
That's fine.
Okay. I'm going to start by washing my hands. All right. Could you tell me your name and date of birth, please?
My name is Elena Galit, and I was born June 2nd, 2002.
Great. And do you know what year we're in?
2016.
And who's the president?
Barack Obama.
Not for long, right?
Right.
Okay. So Elena, I'm going to begin your exam by just doing a visual inspection of your skin. I'm looking for any redness or swelling. I'm looking for any drainage, any open areas, any concerns with raised areas. And I'm going to check your hands as well. And I'm looking at your nail beds. I'm looking for capillary refill, so I'm just going to depress one of your fingernails. Good, and your capillary refill is about 3 seconds, so that's perfect. Your nails are well manicured. I'm just looking to see if there could be any fungal issues and just the condition of your skin overall, and it looks nice and healthy, nice and pink. And then I'm going to look at the symmetry of your head and all of your features, so your eyebrows, your eyes should all be symmetrical. I'm looking at your scalp as well. And then I'm going to just touch your hair, and I'm just checking your hair for any infestations and looking at your scalp to ensure there's no crusting, any open areas. I'm looking for any dryness. I'm looking at the distribution of the hair and the quality of the hair. And then I'm feeling the scalp for any bumps or depressions. And then also if there's any tenderness when I'm touching your scalp.
No.
Okay, good. Okay, coming back. So why don't we start with your eyes. So always starting with a visual inspection, I'm looking for your pupils. I'm looking to make sure that they are equal and round. I'm looking at your irises. I'm looking at your eyelashes to ensure there's no crusting or drainage. I'll have you just remove your glasses for me, Elena. I'm going to just pull down your eyelids here, and I'm going to look at the sclera and the conjunctiva to make sure it's nice and pink, and your sclera should be nice and white. Just have you look up for me. Good. And I'll do the other side. Good. Just looking at your eyelids, making sure that there's no lid lag over your pupils, and there's not. So your eyes look good. Then I'm going to check your visual acuity. This is a Snellen chart. So this is going to test cranial nerve number 2, the optic nerve. I'm going to hold this about 14 inches in front of your face, and I'd just like you to read the numbers for me. So we're going to do both eyes, and then we're going to do your left eye and then your right eye, or vice versa, whatever you're comfortable with. And since you normally wear glasses, I'll have you put the glasses on. So I'm just going to measure this out because this card is approximately 7 inches long. So we can start whenever you're ready.
9, 5, 8, 7, 4, 2, 8, 4, 3, 6, 3, 8, 8, 7, 4, 5, 6, 3, 9, 2, 5, 4, 2, 8, 3, 6, 5, 3, 7, 4, 2, 5, 8, 9, 3, 7, 8, 2, 6, 4, 2, 8, 7, 3, 9.
Very good. So have you cover one of your eyes for me, and whenever you're ready, go ahead and read.
9, 5, 8, 7, 4, 2, 8, 4, 3, 6, 3, 8, 8, 7, 4, 5, 6, 3, 9, 2, 5, 4, 2, 8, 3, 6, 5, 3, 7, 4, 2, 5, 8, 9, 3, 7, 8, 2, 6, 4, 2, 8, 7, 3, 9.
Great. Switch sides.
9, 5, 8, 7, 4, 2, 8, 4, 3, 6, 3, 8, 8, 7, 4, 5, 6, 3, 9, 2, 5, 4, 2, 8, 3, 6, 5, 3, 7, 4, 2, 5, 8, 9, 3, 7, 8, 2, 6, 4, 2, 8, 7, 3, 9.
Very good. So that is cranial nerve number 2. And then I'm gonna test also cranial nerve number 2, your pupillary reaction to light. So I'm going to shine this light in your eye and just make sure that your pupils constrict. And that is the direct pupillary response, and then I'll check for consensual response. Looking at the other eye to ensure that your pupil constricts when I shine light in it. Very good. Okay. So then we'll check your peripheral vision. So I'm just going to have you let me know when you can see my fingers moving, okay?
I can see.
Okay. Okay. And then I'm going to have you just follow my finger just with your eyes and not with your head. Great, so that's checking the ocular motor, so it's cranial nerve number 3. And then to check cranial nerve number 4, I'll have you follow my finger. Good. And then also have you follow my finger one more time, checking for accommodation. Very good. And cranial nerves number 4 and also number 6 involved in the peripheral vision test. And then I'm going to look in your eye. So I'll have you remove your glasses for this portion of the exam. I'm just going to get kind of close to your face. I'm going to be looking into your pupil. I'm going to be identifying the optic nerve, the arterioles, the veins, and the red reflex. Okay, so. And when I look in your eye, I just need to make sure that I move my head with the ophthalmoscope. And if I'm unable to identify the optic nerve, I should identify an arteriole and follow that. Okay, very good. All right, so I am also going to check cranial nerve number 11. So this is just checking your spinal accessory nerve. So what I'd like you to do is just push up. Very good. Okay. I'm also going to check cranial nerve number 5. The motor and the sensory responses. So I have a cotton ball here, and I also have a toothpick, and I'm just going to touch some spots on your face, and I'd like you to let me know if you can feel it, okay? Good. That's checking cranial nerve number 7. Okay, and then this is the toothpick, just a light touch here. Very good, okay. And so then I'd also, what I'd also like you to do is now open your jaw for me. I'm checking the temporomandibular joint to make sure there's no clicking. You can close your jaw, and then I'd like you to clench your jaw. Good, so I'm checking cranial nerve number 5, to make sure that your muscles are working well in your jaw. I'll have you do a couple of exercises for me. So I'm going to have you raise your eyebrows. Good, and then relax and squint your eyes really tight. Good, and then puff out your cheeks for me. Good, and then give me a smile and a frown. Okay, good. I'll have you stick out your tongue. Excellent. And then move it side to side, checking cranial nerve number 12 there. So just making sure that the hypoglossal cranial nerve is intact. Okay, so then we'll move on to your ears. So I will grab my otoscope. All right, so I'm going to check your ears. I'm always going to start with a visual exam of your ears. So I'm looking at the outer ear. I'm making sure that there is no drainage. I'm looking for any redness or swelling. I'm just going to palpate some of her ear to make sure that it's not tender to the touch before I proceed with the inspection. So Is there any pain here when I touch your ear? How about when I touch behind your ear? And then when I push on the tragus here, is there any tenderness? Okay. I'm going to pull up on the pinna and look into her ear canal, and I'm looking to identify the tympanic membrane. I'm inspecting the ear canal. I'm looking for any redness. I'm identifying any cerumen, and just looking for any abnormalities, blockages, or foreign bodies. Is that painful at all?
No.
Okay, so I can go ahead and just move the otoscope forward just a little more. Okay, very good. And I'll come to the other side. Looking at the outer ear, looking for any abnormalities, and then I'm just going to palpate the tragus, any pain there. I'll look behind here. Okay, good. And I'll check inside the ear canal here. And I don't see any fluid in either one of her ear canals, so that's perfect. I'm just going to clean this off with an alcohol swab because I am going to be checking her nose in just a moment. While this dries, I'm going to perform some hearing tests on her. So I have my tuning fork. Elena, I'd like you to let me know when you do not hear the vibration of this tuning fork after I place it on your behind your ear, okay? And now, okay. So this is the Rhine test, and we're testing cranial nerve number 8. Okay, very good. And then this is the Weber test. I'm going to do the same thing, place it on top of your head, and you tell me if you can hear it in just one ear or both ears, okay?
I can hear both.
Okay, perfect. All right, the next exam is the whisper test. So I'll have you cover your ear. I'm going to whisper a word to you, and I'd like you to just repeat it back to me, okay?
Apple.
Good. And cover the other ear.
Baseball.
Okay, very good. So cranial nerve number 8 is intact. And then we'll test cranial nerve number 1, the olfactory nerve, checking your nose. So first, again, a visual exam, ensuring that the septum is at midline. I'm looking for any nasal flaring, any crustation or drainage, redness, abnormalities of the nares. I will then just take a peek up her nostril here. Lean in a little bit more, Lena. Okay. I'm looking for any redness, any drainage, looking at the mucous membranes here. Okay, we'll move to the other side. Okay, very good. So just checking the patency of the sinuses, making sure there's no swelling or foreign objects in there. So Elena, I'd like you to cover one of your nostrils. Close your eyes and tell me what you smell. Coffee? Very good. And I'll have you do the other side, and this is going to be a different scent.
Cinnamon.
Very good. So her cranial nerve number 1 is intact, also was able to test for patency. She's breathing in fine through each nostril independently, and there's no congestion noted. Very good. So then we'll move on to the mouth exam. So I will just observe her mouth, looking at the lips, looking for symmetry, any facial drooping, any involuntary facial movements, anything like that. And I'll have you open your mouth. I'm just going to look in your mouth with this, and I'm just inspecting the mucous membranes. I'm looking at the dentition to see if there's any decay, looking for any open areas or sores in her mouth, looking at her tongue, looking at her soft palate and her hard palate. And then I'm going to have you lift your tongue up to the roof of your mouth. I'm looking at the floor of the mouth. Okay, very good. And I'm going to have you stick out your tongue and say ah, ah. Good. I'm looking at the uvula, which rises, and I'm seeing her tonsils. So her tonsils are at about a 1+. They're intact. There is no redness or foreign bodies in there. So having her stick her tongue out and say ah is cranial nerve number 12. Also checking her gag reflex. So I'm going to just use this plastic spoon and advance it in your mouth and just make sure that you have a good gag reflex. So open up. Okay, very good. That's intact. Okay, so now moving on to the neck. So I'm just looking at the neck first, looking for any goiter or any swelling anywhere. Then I'm going to check all of her lymph nodes. So using the first 3 fingers of each of my hands, I'm just going to use a little bit of a rolling motion to check her lymph nodes. So I'll start with the pre-auricular lymph nodes and move to the post-auricular area and down to the tonsilary lymph nodes. And then I will check the submandibular, submaxillar, pre-cervical, post-cervical, and then I'm going to check the deep cervical, so I am going to have you turn your head all the way to the left, Elena. Just palpating here. And how about to the other side? Good. Any pain or tenderness there? All right, I'm looking for any inflammation anywhere. This is the supraclavicular lymph nodes, and the infraclavicular, and then the occipital. So I have a little glass of water here for you. I'm going to come around, I'm going to look at the, check the trachea. I'm looking to make sure that it's in the middle of her neck, that there's no deviation. And I'm just going to come from behind and feel the trachea. Good. And then I'm actually going to try to find the thyroid gland and have you swallow for me, Elena. I'm trying to feel for the rise and fall of the thyroid to see if it protrudes out. Do it again. Very good. Okay. Now, one last thing I wanted to check when we were checking your face is I want you to try to push your eyes open when I try to make you open your eyes. Don't let me. So if you squint your eyes really tight and then open them, good. And then also I want you to push against my hand with your jaw. Try to open your jaw. Okay, very good. So just checking to make sure that cranial nerve number 5 and number 7 are also intact. Okay, very good, Elena. Thank you so much.
Thank you.